The danger of the virus falls especially on women. Globally, women are 70% of the global health workforce. They perform 3/4 of the total hours of unpaid care work, more in some cases. We know that GBV, gender-based violence, and intimate partner violence is rising and is likely to rise. As with most humanitarian disasters, that's what happens. Women and girls continue to need to access sexual and reproductive health services, obviously. But as health providers are overwhelmed, the danger is that they don't get the access they need to the qualified support that is necessary.
How COVID is impacting women and girls worldwide varies very much depending on where you are, because in the developing world, it is first and foremost a health crisis, an economic crisis, and then a health crisis. Very different to what has happened in Europe and the US, where it is a public health crisis first and an economic crisis second. Women's groups are not able to have the influence that they should in policy making and decision making. They do not have a seat at the table.
The impact of COVID-19 pandemic is much more catastrophic in situations of armed conflict. The travel and mobility restrictions have severely inhibited the delivery of relief and essential services and humanitarian aid to vulnerable groups.
Frontline first has got to be more than rhetoric in the response to this crisis. Frontline first means local people being agents of their own protection. It means local NGOs being partners of international NGOs so that we get the best of both.
Let's now start a dialogue around, can we reduce defense expenditures and can we move some of these both to public health issues as well as to other issues, including stimulus packages that reach women. We have to push for women at the table.
While governments remain undecisive or are caught up in their politicking, women and youth peace builders in local communities are out there doing life-saving work. That's where I see hope.